right, welcome to the fourth installment of William Newton News Watch. I'm the hospital's Director of Marketing, Sarah Johnson. We're hosting a watch party right now on Facebook, so please talk to us in the comments. You can ask questions or let us know what you'd like to see, and we will do our best to respond live or address it on the next show. As the state of Kansas reopens, so does William Newton Hospital. Nearly all of our hospital services are open, including elective surgeries, with additional safety precautions in place. And one of the most important safety precautions is the use of a face mask. And that is the focus of today's show, masks. The people of Cowley County have been working hard to flatten the curve. Our local health department has acted swiftly in enacting precautions, and our community has rallied to protect each other. As a result, the number of positive coronavirus cases as a percentage of our population has remained low. But to keep fighting COVID-19 as the state of Kansas reopens, healthcare providers in Cowley County are teaming together to encourage citizens to mask up in public. Joining me today is Taylor Schwartz, the Community Outreach Coordinator at the Community Health Center in Cowley County. Hi, Taylor.
Hello, thank you for having me.
Tell our viewers a little bit about the Community Health Center.
So the Community Health Center is a low-cost health clinic. We serve patients with and without insurance at a lower cost. Basically just a regular doctor's office with the added benefit of being able to help those without.
Okay, and the Mask Up campaign originated at the Community Health Center, and local healthcare partners, including the City-Cowley County Health Department, South Central Kansas Medical Center, and William Newton Hospital have teamed up. So tell us why it's important for the public to keep masking up, even though social distancing requirements have been lifted a little.
Yeah, so there are several reasons. First, there's no way to know if you're asymptomatic or pre-symptomatic, and you could potentially be spreading the virus to those who are most vulnerable. Secondly, your mask protects others if you are infected, while theirs protects you. And lastly, you never know who's at risk around you. Who has been exposed.
And there is quite a debate about masks, and sometimes it's confusing when to wear a mask. Sometimes it's even counterintuitive. Can you explain to us maybe when it is appropriate to wear a mask?
Yeah, sure. So basically mask up whenever you're in contact with the public, like at the grocery store, the doctor's office, or the hospital, just anywhere where it's difficult to maintain that 6 feet distance. You don't have to wear a mask when you're outside doing activities like biking or walking or running. And you don't have to wear a mask whenever you're at home or in your car either.
Well, thank you so much, Taylor. We also have joining us today our education coordinator at William Newton Hospital, Mel Burnett. I'm going to take it over to Mel.
Hi.
So today we're talking about masks, and I understand you have a few different types of masks to show us. Can you just show us a few of the different masks we have at the hospital and maybe some that might be available in the community?
First one I'll show you is the one that I wear most of the time, and it's this one. It's called the ear loop mask. It has kind of a crease in it because whenever I come back to my office, I take it off because I'm in here by myself. Kind of like Taylor said, there's times when you need to be wearing it and times when you can take it off. So this is the kind I wear. And then we have a surgical mask, which when you have it on, they kind of look similar, just the way that they attach to you. So this one goes on like this, and it ties behind your head and then has straps that tie behind your neck. And again, that's the surgical mask. And then we have what everybody keeps looking for, the N95 respirator. And this is just one style of it. They have several different styles. This is a style that I wear because you have to be fit tested for this, whatever style that you wear. And then thanks to our fantastic community members, we have some cloth masks that we use to prolong the life of those. And we have the surgical mask style, the air loop style in the flex kind, and then my personal favorite, Kansas City Chiefs, because I'm a major Chiefs fan.
What are some of the common mistakes you see when you see people wearing a mask either in the hospital or out in the community?
Well, I can tell you one that I seen just yesterday. When you have the mask on, it's supposed to cover And the way they're made, they're supposed to cover from your nose down to here. That's how you put them on. But yesterday, I seen it went like this. The thing is, if you have a mask on like that, you might as well take it off, because the mask is to protect your respiratory system or protect others from your respiratory system, and your nose is connected to your respiratory system. So it's kind of not doing its job if you have it on like that. Another thing I see with these kind of masks a lot is people have it on if it's tied like behind their neck, and then they decide that they don't want to have it on for a little bit, so they untie the head strap and drop it down like this. So you shouldn't be touching this part of the mask at all. And so when you drop it down like this, then that means you're contaminating your clothes, or in my case, it would be skin right there. And then they put it back up on here. So this is the filter part. That's what catches all of the bacteria or viruses or whatever. So if you're going to take it off from your face, you should take it off and dispose of it. Don't lay it down like that, because then not only are you contaminating this, but this right here is what goes next to your face, and you're walking around with this right here, getting bacteria and viruses on it as well.
You mentioned saving it for later, but there is a time when it is appropriate to throw it away because it's disposable. Can you kind of give us some insight as to when might be the right time to get a fresh mask?
Dirty, if you see it soiled, if you see it has like a lot of makeup on it. In fact, because like this one, I'll be disposing of it today. You can see the lipstick on it. If it has makeup, if it's soiled, if it has, if it gets wet, if you sneeze in it, cough in it, whatever, then that one should be done.
And it is recommended to wash your cloth mask daily if you're using a cloth mask. So to close, there is, quite a debate about masks out there. From a nurse's perspective, why do you think it's important to keep wearing masks, even though some of those social distancing restrictions have been lifted?
Well, Taylor kind of mentioned one of them. You don't know who around you, including yourself, is asymptomatic with this virus. I wear a mask. I have made masks for my grandkids. When we go to Walmart or Costco just this weekend, we wear masks. That's what we do, because I've taught my family and others around me to cough or sneeze into their elbow, but not everybody does that. So when you're going out in the community and people around you are coughing and sneezing and they're not doing it in their elbow, it's just going out into there. You can use that mask to help prevent you from getting what they're coughing out in there. And not only that, we've taught everybody about washing their hands for that 20 seconds multiple times. If you touch something or get your hands into something, you wash your hands. But the thing about the mask is, this mask is, if nothing else, think of it as a reminder not to touch your face, because this virus, a lot of the way that it's getting into people is hand to face. People are touching things and then they're getting it on their face, and they don't even realize it, because in society we touch our face, we move our glasses around, we scratch our nose and all of that. And so if nothing else, if people are going to argue that mask doesn't block anything from getting in, fine, but it keeps you from touching your face. So if nothing else, use that argument. Mm-hmm. But you really do need a mask, because you're protecting yourself, you're protecting your loved ones, you're protecting that immunocompromised person that you don't even know that may be 6 feet from you.
Yes. So, thank you, Mel. Thank you for tuning in this week. The link to the CDC's guide to face coverings is included in this post. So if you don't have a mask, this is an excellent resource for how to create one, maybe just using things that you have at home. Please let us know in the comments who you'd like to hear from the hospital next time or from the community. And just remember, mask up to fight COVID-19.